Hi, my name is Caitlin Donahue. I'll be doing a physical assessment. For the purposes of this video, my equipment is clean. I've done my critical elements. I've washed my hands. I have checked my chart, and I'll be listening to the heart and lungs over the clothing. Go ahead and start. Come in. Hi. Hello. My name's Caitlin. I'm a student nurse at Valencia. I'm going to raise your bed a little bit. I'm going to wash my hands. I'm going to check your identification. Could I have your name and date of birth?
Laura Engel, June 9th, 1985.
Okay, and I can see the MRN matches and everything matches. I'll close for privacy. Could you tell me, do you have any allergies to food, environment, or medication?
No.
On a scale of 0 to 10, 0 being no pain, 10 being the worst, could you rate your pain for me?
2.
Where's your pain?
My wrist.
What kind of pain is it?
Dull.
Is it radiating?
No.
Does anything make it better or worse?
No.
And how long have you had the pain for?
About a week.
Do you want any medication for it?
No, thanks.
Okay.
Thanks.
No? Okay, so I'm just going to be doing a physical assessment. If you could just sit up on the edge of the bed for me. Make it a little bit easier. So I'm going to go ahead and start with your scalp. You can see that everything looks good. Your skin looks good. Could you open your mouth for me? Stick out your tongue and smile. Okay, so everything looks good. Look in your ears and your nose. Okay, I'm going to assess your pupils. So they both look to be about a 4. I'm going to shine a light in your eyes 2 times for each eye. Once, and the other eye, 1 and 2. Okay, you can just focus on something far away. I'm going to put my pen right in your field of vision. Just go ahead and focus on that when I say when. Go ahead. Okay, so everything looks good. Next, what I'm going to do is I'm going to be assessing your circulation. So I'll start with your carotid pulse in your neck. Okay. So I will do 1. Good. Also going to assess your radial pulse right here. Okay. And your radial pulse. Good. So your skin looks good. Go ahead and check your perfusion. Okay. If you could just put your arms up, go ahead and pull against my arms and push. And then go ahead and squeeze my fingers. Good. So nice and strong. You have your femoral pulse right here. We're not going to be checking that right now. I'm going to move down to the pulses that are behind your knees, your popliteal pulse. Okay, feels good. Raise up the bed just a little bit more. I'm going to move down to your tibial pulse. Okay. Okay. And your pedal pulse. Okay, if you could just push on my feet and pull. Okay, and I see you have good perfusion. Good. Next, what I'm going to be doing is assessing your lungs. So I'm going to listen on your back first, and then I'm going to listen on the sides and then the front. So each time you feel me put my stethoscope down, just go ahead and take a deep breath, okay? So my equipment is clean. Okay, and go ahead and put your hands on your hips. Okay, and then 6 more right on the front here. Right underneath. Okay, sounds good. What I'm going to do next is I'm going to listen to 5 areas for your valves. I'm going to do the aortic, the pulmonic, the second pulmonic, the tricuspid, and the mitral valve. Okay? When I get to your mitral valve, I'm going to listen to your apical pulse for 1 full minute. Okay? And this is where I listen for 1 minute. Okay? So next what I'm going to do is I'm going to assess your abdomen. If you could, just go ahead and lay down. It'll make it just a little bit more comfortable.
Okay.
And when was your last bowel movement?
Yesterday.
Yesterday. And when was the last time you urinated?
This morning.
This morning. And when was your last menstrual cycle?
Last week.
Okay, so I'm going to inspect the abdomen. I see it looks good. I'm going to auscultate next. I'm going to listen to all 4 quadrants.
Okay.
Okay. Next, I'm going to lightly palpate. If you feel any discomfort or pain, please just let me know. Okay, everything looks good. Okay, so I'm all done with your physical assessment. Could you rate your pain for me on a scale of 0 to 10, 0 being no pain, 10 being the worst?
0.
0. Okay. Do you have any questions for me before I go?
No, thank you.
Okay. And you have your call bell within reach. Your bed's in the lowest position. Both your side rails are up. Okay, just go ahead and give me a call if you need anything.
Okay.
So I'd leave with my computer. I would wash my hands, document, and I'm all done.